What's going on, y'all? Zach Henderson here, and I am with a good buddy of mine. This is Dr. Scott Dunaway, also known as Cairo Strength on Instagram and the interwebs at large. He is a super smart guy, and I couldn't be more thrilled to have him on board to share with us some information about the squat, specifically through his lens of expertise. So Scott, take it away.
So what we look at most often with squat, people overemphasize, well, maybe not overemphasize, but they try to jam a square peg into a round hole often. They try to go really heavy on the mobility if they feel a pinching, if they feel a strain, if they don't feel quite right in the squat. They try to either get more hip flexion, hip external rotation, internal rotation. They try to really, sometimes at the detriment to their joints and tissues, especially the capsule of the hip, they can create more of an issue other than trying to figure out from their anatomical structure what squat style, what stance suits them the best. Whether that's a degree of toe out, a degree of hip flexion, how wide the feet should be in a squat. And not saying that you can't improve that stance with some mobility, but there are some tests that give you a good starting point. And whether you're a trainer trying to figure out how should I best start this client in a squat pattern, or you are coming into your own rehab or trying to do something from a standpoint of building the squat, here's a few drills you can do to at least have a good starting point of what your structure will allow to be the most efficient squat. And then from there, having somebody like Zach who can coach you through the mechanics of how to squat with heavier weights or through more load, you can start to improve your squat, whether it's with weight or with your doing powerlifting or kettlebell style or pistol squats, to be able to improve that squat pattern. So let's go ahead and get started with the first technique here. So I'm going to have you go on your back here, Zach. And the first thing we're going to look at is the degree of toe out. A lot of people try to jam their toes straight forward, and there is a degree of your hip that plays a role in what's going to be comfortable for you. But also, if you bring the patient's leg up to 90 degrees of hip flexion, there's a part of the tibia or the lower leg bone that you can feel a big prominence here. It's called the tibial tuberosity. So what I'm looking for here is when I hold the knee still and give a little bit of rotation to the knee, there's a little bit of give there. And what I'm looking for is when this tibial tuberosity is pointing straight up towards the ceiling, what direction are the toes pointing? So with a little bit of dorsiflexion here, I can kind of ask him to lock your ankle in. So give me some good dorsiflexion, right? You don't have to go that much right there. Just lock that ankle in. And now I can use his foot to kind of turn and making sure I'm not getting inversion, eversion of the ankle. If that's all locked in, when I put this tibial tuberosity pointing straight toward the ceiling, his toes are pretty much pointing right up there. Now what you'll see, and I'm kind of a case of this, what you'll see with some people, whether it's because of how they, from birth, how the bones grew, or whether they had a lower leg injury or anything like that, oftentimes what you'll see is when that tibial tuberosity is pointing straight up, they have a little bit of external rotation of the foot. And it's not necessarily something that's a range of motion issue, but it's just their structure. So if you point that tibial tuberosity straight forward and you see a little bit extra rotation, that tells me that if you try to squat with the toes straight forward, that's going to be a big strain on the knee. So watch out for that one. So the next step we're going to do, after we find out if there's any tibial rotation, we're going to do something called camming of the hip. So this is with the patient nice or the client nice and relaxed. And what we're going to look for is as we push the leg straight up, we're going to see what angle does the knee track towards the shoulder, outside the shoulder, or straight up that feels most comfortable. So Zach, if you're just relaxed here, I'm just going to push the leg up and just figure out where that knee wants to go. So it just kind of falls right into a pocket here. And this knee is probably right outside or right around shoulder width apart, right? So if I try to go straight up towards the shoulder, I'm just going to push, and I start to feel some resistance right here. Now, Zach's mobile enough to where he can probably go further, so I'm going to push this further. You tell me what you feel. So I'm going to keep going. So I'm getting a lot of resistance here. Zach, what do you feel?
Yeah, it's getting a little tight there to the inside of the hip.
So if you, depending on how tight you are or how your hips are, some people get a lot of pinching in this position. So if you feel like you're getting pinching here, you might want to come out to the side. Now if you're a powerlifter style squat that's really wide, oftentimes you'll see they will prefer way outside like this. Now when I get Zach to his most comfortable hip flexion, if I try to go further out into abduction, he ends up kind of coming back down this way. So for me to kind of jam the hip up in this position, again, it's probably feeling pretty tight.
Yeah.
This is just his nice, good neutral, which is pretty traditional style feet, a little wider shoulder width apart. And with this knee now, tibial tuberosity pointing this way, he'll have a little bit of toeing out that will align with that tibia and this hip flexion. And that's going to be a good position for him at the bottom of the squat. So the next test we're going to do is one called the Craig's test, and it's a way to see kind of how your hips set in the socket from a standpoint of anterior-verted or retroverted, or meaning does it bias internal rotation or external rotation with the range of motion. So go ahead, Zach, flip on your belly. And this is a really easy one. Essentially what we're doing is we're using prone, internal rotation, which is the foot towards me, external rotation, the foot across midline, and figuring out where we feel his hip bone become most prominent. So as I start over here, if I'm feeling this greater trochanter of the hip bone here, and I start to push the foot over, I don't feel hardly anything under my hands here, and as I push over, I start to feel that bone become more prominent, and at some point it starts to disappear, and now I don't really feel much of it anymore. So where is the most prominent is kind of where the neutral part is in his hip. So as I'm coming over, it's starting to come up under my hand now, and about right here is where I feel the most prominent. So if I go any further, it starts to become less prominent. So this right here, which again is pretty neutral from a standpoint of he's not really far over to external rotation or internal rotation. So he's pretty textbook, if you will, right? Pretty vertical tibia, maybe a little bit biased towards external rotation. But what you'll notice is some people's knees will just fall all the way out, and they'll have tons of internal rotation. The more internal rotation someone has, likely they'll be a little more comfortable with a narrower squat. If you have a lot of external rotation, you're probably going to feel a little bit more comfortable with the feet a little wider. Not to say that someone that doesn't have tons of internal rotation can squat narrow, because you can work on that mobility, but from a strict skeletal standpoint, you're probably going to do a little better with the knees a little wider, the more bias you have towards external rotation. So those are two real simple drills you can use just to kind of see how the hips set in the socket, and from there you can start to build your bottom position in the squat. So what we've done so far is we've kind of assessed Zach's hip anatomy to figure out not necessarily his limitations, but just a starting point for where his musculature and his skeleton. So what we've done so far with Zach is we've done a few tests, and now we know kind of by camming the hip where the hip's going to want to be at the bottom of the squat, kind of with the internal external rotation, the tibia and the hip, where is going to be probably a good starting point. So again, this is a starting point. Zach has enough flexibility where he would probably be capable of doing a bunch of different variations of squat, whether it's powerlifting or more Olympic style lifting or more narrow feet squatting. But this is going to be a good way, again, with a new client to start with, or to kind of do your own assessment of what you should feel like at the bottom of the squat. So we're going to start this in a quadruped position. So Zach's going to get on his hands and knees. Go ahead and face the camera as you do that. And what we're looking for is when we cammed the hip, his knee was just slightly outside his shoulder. So that's where we're going to start the knee. And as far as where to put the toes behind the knee, when we did his camming, we found that the toe was probably a little bit more comfortable right behind it, or just biasing internal, a little bit of external rotation, meaning a little bit inside the knee. Not too much, but you can play around with that as you start to do this rocking to see if it feels like it clears the hip a little better. But we're going to start Zach, and he kind of naturally went there anyways because that feels more comfortable for him. Just the toes inside the knee, just a little bit. So, Zach, what I want you to do, nice, good, tall, proud chest. Think about kind of the bottom of the squat position as you rock back. And we're seeing how much hip flexion we can get while maintaining a good, stable spine here. Come back up. And not to say that rounding is bad, but if we're going to be loading this squat with a lot of axial load in a barbell, we want to make sure we have a stacked pelvis. So what we're looking at is maybe biasing a tad bit of anterior rotation, anterior tilt, but trying to find that good neutral. So he can pretty much get all the way back without really losing all of that position of the spine until he gets all the way down, and then we might see a little bit of a tilt. So just for example here, Zach, let's try to bias you towards a little bit more internal rotation. So we're going to bring those feet out just a little wider. So now I'm going to try to see if he can come back into that squat and what it feels like. And he starts to slow down and stop much sooner. What's that feel like in the hip?
Just like I run out of room.
Okay, just real tight, right? So you can, once we find the knee angle of the squat by doing that camming, you can play around with what feels more comfortable. And so with that in mind, what we're going to do is we're going to kind of rock out of that position. You're probably going to scoot a little bit further forward here. So we're going to rock out of that position, and what he's going to do is he's going to kind of bring his hands in and push himself back into a low squat position. I'm going to go ahead and put this kettlebell right here. And I'm just going to use this kettlebell here because it's going to be a little counterbalance as he gets back to the bottom of the squat position. So push yourself back, try to lock in, keep a nice, good, stable back, and now grab that kettlebell. Good. And now he's in the bottom position of the squat that he started that quadruped position. Does that feel okay?
Yep.
Go ahead and stand up from there. Good. And now back down. Good. Back up. Good. Does that feel okay?
Yeah, absolutely.
Perfect. Now put that kettlebell down and come back into the quadruped position. Good. And that would be the starting position. So if you wanted to play around with the bottom of the squat, he could play around with how wide his knees are, how internally or externally rotated his hips are at the feet, or his hips are because of the foot placement. And that's just going to be a good starting point. Once you find the bottom position of the squat, then it's just a matter of how to create proper tension through good coaching and performance coaching, how to create good solid tension, maintain that tension to be able to drive out of the bottom of the squat. And that's where a coach like Zach's going to come into place that can really teach you the technique of squatting. This will just teach you where you should kind of finish. And at that point, it's a matter of connecting all the dots, and that's a good way to be able to kind of do some self-assessment for your own squat.